Hi, welcome to the home stretch of the comprehensive training. We're going to discuss this session on participatory approaches for monitoring and evaluation. I'm Lora Shimp, working with John Snow Inc. Thank you for joining. For outlining this section, we want to talk about what we mean by participatory monitoring and evaluation and how that applies for the vaccination communications and demand. We'll discuss several participatory approaches in this context and provide some country examples of these participatory M&E approaches and a summary of. We have a few different definitions that we'll be looking at. One key element of this is the interactive way that we do participatory monitoring, as the word participatory implies. We also want to limit being extractive. In other words, really trying to not gather information that is only beneficial to the end product, but rather really having that interface and interactive way of sharing information and learning. And then, of course, the quality improvement aspects for really achieving successful and sustained. So when we talk about participatory M&E, we really want to look at both the audiences and the recipients and the input that they provide, making sure that we're getting that perspective and feedback that is representative of our groups that we are reaching, but also can contribute to the various measurements that we want to look at. So not just impact, but also those process outputs, the outcomes, and the learning that we have along the way. And that includes often qualitative and quantitative data assessment, so that we look at the communication components as part of a more holistic approach with other health indicators. And of course, some of these participatory indicators may include confidence in vaccination, attendance at services, and of course, are the quality achievements being made and appealing and meeting the needs of the various users in the program. So why is this important? Oftentimes, as we said earlier, we can extract data that really is about numbers vaccinated, a percentage covered, but it's not getting to the routine monitoring and how we're using local data for analysis, decision-making, and that process learning along the way. So we really want to be able to include participatory monitoring so that we can synthesize evidence, we have qualitative and quantitative components, and we really look at the learning as part of the bigger whole so that we have on-hand decision-making, but particularly by those gathering the data, but also a collaborative approach for really making all of our users and those engaged in the program part of those feedback loops, the input that's provided, and particularly the joint review and assessment so that they can link this back with their activities. And so here we have some examples of participatory approaches that you could use for your monitoring and evaluation. We have different types of interviews that are often able to be organized, either exit interviews at facilities or at services, key informants through a small sample size of people who are involved in the program, intercept interviews also for those who are participating in the service where you can reach them at the time that they are actively engaged. For a larger group, you might want to consider snowball sampling, which builds from continuing sources, contacts of already interviewed people who might also have interest in the information or be able to provide you with information relevant to your M&E. Also, the other methodology of most significant change, that might be based on narrative, but you look at what has happened over time, engaging with people who've been impacted by the program so that you can look at trend analysis and what's been happening that has had that continuous effect and moved the initiatives forward in positive ways or in ways that are relevant for your monitoring and evaluation. There's other types of approaches that you can use, such as case studies, narratives, personas, that provide a third-person perspective where those involved in the program might find it easier to speak about their experiences when they're going through a case study, or personas that might relate to what they're doing, but where they can provide their inputs without having to have it be too personalized. Then, of course, in that interactive component where you really want the participatory feedback, there are different types of reviews, such as monthly or quarterly review meetings, quality improvement methodology, the Plan, Do, Study, Act cycles, and also different initiatives that have been done, such as My Village, My Home, which looks at vaccination cards, home-based records, community registers, immunization, facility registers, and of course the quantitative data such as tally sheets or summary sheets of what's been done in achieving coverage, while also looking at the interactive elements of the program where communities and clients might have information. You've also learned previously about the tailoring immunization program and some of the socio-behavioral data that are also very important as part of your participation to collect for your monitoring and evaluation. And as was learned in the Champion Community Approach in Madagascar, really building community measurement, collective scorecards or indicators across a variety of health interventions or across a variety of methods that you've used to really get the community as part of that evaluation process. Then in the digital aspect, you might have application-based quizzes or types of assessment that are built into an app on the smartphone, or you might use 30-second, 1-minute community videos where you have then feedback provided around those videos, as well as types of online surveys that might be free to use or low cost, such as Mentimeter. You see the URL here if you want to use that approach, or online surveys that can be done relatively easily for online users such as SurveyMonkey, or interactive voice responses where you have some automated messaging that can provide user feedback. So what does this look like in practice? As you see here in this intervention area, the circular nature of this is very important, where you're looking at how you provide the service. So for example, home visits, the trainers and facilitators who are part of the training, that collective vision that they have in dream building and self-assessment. Where do we want to go with the practices? How do we want to perceive this in the community, but also as part of our own initiative in the interventions that we're performing and that we're trying to measure. So all of that you want to lead into an action plan that is jointly developed, where those monitoring and evaluation indicators are brought in from the beginning process, a consultative process, so that when you follow through with the actions and the review, you have an opportunity to bring the communities together to share that learning, exchange ideas, look at the metrics that have been used to measure performance and the processes, and then circulate that back into the initiative for updating your program. It's meant to be participatory, such as with review meetings, where you have the data and you have both quantitative and qualitative means of measuring your performance, but you look at this very much in an analysis and interactive way that both enables self-assessment and peer review, so individual monitoring and evaluation by the users, but also that chance to exchange information and perspective, to look at the data findings and enable cross-learning, both from facility staff as well as with the communities that are involved in the program. And then are you using those review meetings as an opportunity to reinforce recommendations, to make on-site correction, and to build it into the supervision and monitoring in a coaching way that enables more mentoring and peer exchange, so that you're using all opportunities for review to build in that monitoring and chances for stepwise improvement in your evaluation. So one example mentioned previously is the quality improvement methodology. That looks at Plan, Do, Study, Act cycles, and the UIFHS project. You'll be able to look at the link in the resource page. they were looking at microplanning with communities and how monthly data and activities were reviewed collectively. They had quantitative measurement, so easy to use indicators such as number of vaccination sessions that were held versus planned each month. And then, of course, were caregivers and adults informed about the sessions compared with the ones that actually came to the session. So intention to action. And those participatory actions that were done as part of the review process looked across performance, output, and outcome. So collectively reviewing whether or not they were able to assess the interactions with caregivers, with newborn and infants, and then were those activities linked with improved tracking of caregivers as well as attendance at the vaccination session. And taking that root cause analysis, as you see in the photo here, to really dig into which indicators are the ones that need to be followed up and measured in a continuum. So this is an example of how the data were then presented, where you see district level scoring based on the supervision checklist and that feedback and monitoring process, where they can look between supervision visits for improvements in the way that the data are analyzed and used, and then also the quality. Have they been able to show not only increases in coverage, but also use of the tools and accountability, and being able to show this in baseline, endline, and other graphic ways that very quickly can show your participatory monitoring. Additionally, as I mentioned previously, in the My Village, My Home and home-based record process, as you see here, there's a way that village health workers and village heads linked with the facility nurse or facility vaccinators will look at the registers in the system, both the register that is held by the Immunization Center itself for outreach and vaccination sessions, but then also these community-style registers, as you see here, where you can do name-based tracking of each individual that's visible to the community. So the community sees every child, their vaccination status, and as the year progresses, a complete picture by all children being vaccinated with these squares filled in for every child's antigen that's been received. With displaying these charts in a participatory way, you have the visibility that the community can see, which also links with the health worker tracking and the reporting that's done by the sessions themselves. And this enables a good opportunity for village health committees, for village health workers, for the facility and communities and caregivers to see the status of their vaccination program and to look collectively at the children as one community. So when Zimbabwe did this, you see in this example that there were 2 supported districts in Manica land. When they began implementing this, they looked very closely at not only the nursing cadre, but also the community health nurses, the rural health center nurses, and the other village influencers who should be part of that initiative to really be able to measure whether or not more home-based record availability also meant increases in attendance at sessions and the tracking with community people. When they went to do the participatory evaluation, they conducted caregiver exit interviews, health worker interviews, spoke with village health workers and the village heads so that you had a comprehensive look at different informants who could be part of that evaluation process. So they randomized this based on the selected districts as they expanded the approach, and then also looked at the different types of interviews to snowball sample around the feedback that they could receive. Based on this, you see some of this summary of some of those participatory evaluation findings, where you see, for example, good increases in card retention. So the child health card has higher retention. You see knowledge of the tracking system through My Village, My Home, and knowledge of vaccines administered. Now, of course, things like due dates and the use of the tools also needs to be measured over time. So you see in the village health worker interpretation, they are able to now reach more children through the tool, but they need more assistance in being able to complete the verification of caregivers and children due for services by name. So really trying to find those infants that have been missed or have not come back for services, and being able to do that defaulter tracking with the registers that they have. So being able to take the findings from this participatory approach into improved activity. And here you see that between the 2 years of interventions, they actually were able, along most indicators across most districts, to see some improvements in coverage that they can link with these improved caregiver and My Village, My Home and child health card use. Now, of course, this is only a 2-year period. To really understand whether your M&E has been effective, you need to look at longer term trends over a 3 to 4 year period, particularly when you know you have denominator issues. So you want to look at numbers vaccinated and not just percentages, so that you see whether or not your numbers increase every year, while your percentages also hopefully are increasing and you have a better idea of your data. So another example is in the community perceptions of health services from interactive voice surveys that were done. So in December for COVID, December 2021, there was a platform used to really understand community perceptions on access to services and other areas, and then using this VIAMO 321 service, how to use mobile networks for gathering information around perception. That there were interactive voice responses that were collected from the countries where you see certain indicators that came through, such as, do you have access to health services near where you live? And then if you have access to vaccination, did you go to get vaccinated? And this is a good way to get local, more mass information feedback through respondents as part of a broader initiative for information gathering and assessment. These results can then be included in community-led actions to see, will people participate? What can you ask them to look at hesitancy, and data that hopefully will lead to uptake and action, and then looking at how supply or service-related challenges might be able to be built around the feedback that you've received through these participatory approaches, and considering the social behavior change aspects of this in your program along with your quantitative data. So in summary, we see that participatory methods are very important to involve and foster the recipients' and implementers' perspective. So hence the word participatory. It's meant to be feedback and feed in, and you have that from the planning through to the evaluation processes. You also want to really consider appropriate technology. Perhaps lower resource settings might not be able to have high-tech digital solutions, where you consider SMS or other types of interviews that can be done with low digital, particularly if you're resource constrained, where you use higher digital and more expensive approaches when you have a more comprehensively funded program. The other truth is that M&E is not understood by everyone. So it really is important to adapt and facilitate that idea of a learning and data culture, really insisting and including that problem-solving approach among all of your participants in the initiative, and building in those opportunities for self-monitoring as well as mentoring, supervision, and feedback loops, so that it is an interactive process and not an extractive perception of the monitoring and evaluation. And best practices, really engaging those recipients and implementers, as we said, making sure that you have sufficient representative sampling in groups of your population. So you can sample a segment, as was seen in the Zimbabwe example, but you want to make sure that that's sufficiently representative of the various users and actors in your program. And always make sure you acknowledge the limitations and any potential response bias. As with most interviews or insight gathering, you do want to acknowledge when you have purposely selected people who might have already been amenable to your program or active in the program. So you want to be able to acknowledge if there's any sort of limitations or approaches that you've used where you might have sampled very purposely in a certain area, and make sure that you paint a complete picture as much as possible with your M&E to show your various results and be able to track your progress. There are different levels of action that you can take. Of course, if in a low resource setting, as you see with the mountain bike, you really want to make sure that at the least you're designing with the recipients and implementers, and really look at the technology and approaches in M&E that make the most sense and are the most resource sufficient for your program, such as local interviews, simple checklists. You can use automated surveys like Mentimeter if you have ensure that everyone has access to internet or the ability to use those tools effectively and doesn't require much data minutes or follow-up. The tracking can be done in Excel, for example, or offline technology. If you have more resources, you can then also consider applying several participatory methods where you look at monitoring activities across different areas like interviews, on digital systems, and maybe doing periodic monitoring a little bit more frequently, such as quarterly with an annual evaluation, or monthly if you can bring that into the system in simple ways. And then, of course, if you have a longer trajectory and an M&E team to help you, they can really look at the facilitated learning and implementation, not only of the results, but also the recommendations. And you can have repeated rounds of M&E where you build on your participatory monitoring so that you revisit the results on a more regular basis to feed into the activity updating every year or every 6 months. And if you have more resources, you can do more electronic M&E, such as doing a more comprehensive e-survey that you could do twice per year or once per year if you have a longer term time. So I'll wrap up here with these various resources. As mentioned, there are several different guides that look at how M&E is incorporated into programs, social behavioral aspects of monitoring and evaluation, different checklists and community-based approaches that you can adapt from, as were mentioned in the earlier slides. And then, of course, some participatory methods that give examples from other domains, not just immunization, and really how you can look at impact evaluation also, as well as other ways that participatory methods can be incorporated into your program. Thank you.